Okay, everyone, how are we? So today we are going to talk about endotoxemia. So I put a file for you guys in I think it's written files there on Canvas, okay? And here's the thing. Endotoxemia is a very severe condition that may happen in these horses, and what I want you guys to know about it, well, there's multiple things, but anyway, endotoxemia, the name itself is when endotoxins are circulating in the blood. When these endotoxins are circulating in the blood, they cause havoc everywhere. So it's important for us to understand that endotoxins come from gram-negative bacteria, okay, so such as salmonella, E. coli, and Pseudomonas, other gram-negative bacteria. So when these bacteria die or multiply, they will release from their cell wall endotoxins. The most common endotoxin is called LPS, lipopolysaccharide. LPS is the one that there's more studies done, and but there's other endotoxins as well. And here's the thing: gram-negative bacteria. So when we have infections with gram-negative bacteria, we have to be very careful. I mean, gram-positive too, but gram-negative has that problem also. Now, endotoxemia can be a result of colic, okay, because that when the intestinal wall is not moving, that barrier is compromised, and now all these contents that are in the intestinal wall and this bacteria start to die because that loop is dying also, and all that content now can reach the blood circulation, okay? And so that is one of the most common places for endotoxins to reach the blood circulation. Now, pyometra, so that's pus in the uterus, can cause that as well. Any kind of, if it's gram-negative. Any kind, like pneumonia, can also lead to endotoxemia. So, and whenever you have this large accumulation of bacteria, especially the gram-negative, you can have endotoxemia. So here's the thing. Sorry, I thought I heard a noise. So obviously, the largest organ that has bacteria at all times in the body is the GI tract. So that's why it's mostly related to that. Why is it that in the normal GI tract, it doesn't, there is no problem? Because you have the motility. So remember, I talked about the peristalsis and the actual motility, and there's competition for food with the good bacteria, probiotics, etc. And the competition for food prevents virulent bacteria from causing the disease, and the peristalsis, so the movement of the GI tract, prevents these bacteria to gain access and to touch the intestinal wall to actually gain entry to the rest of the body. So this is important. Now, and that's why when horses have diarrhea and they already have some sort of GI discomfort, I've said several times, it's controversial to treat when, with antibiotics, especially if it's salmonella, because now you're going to kill a bunch of salmonella and you have the problem with releasing endotoxins to the blood. So this is, things to think about. So now if the horse is septic, he's going to die. So you have to do antibiotics. So there is no, but if the horse is like looking okay, possibly trying to treat and hope that he can get rid of the bacteria themselves other than treated with antibiotics is probably best, okay? Endotoxins are going to cause a dysregulated, massive inflammatory response in the whole body, okay? Dysregulated, massive inflammatory. You guys need to remember that. And this inflammatory, there's going to be multiple organs that are going to be involved, and depending on the organ that is involved is the clinical signs that we are going to observe. So it's important that we all understand that, okay? The other thing too, I was talking how colic can lead to endotoxemia, but horses that have endotoxemia because of, say, pyometra or some other place like lungs infection, will also cause, have signs of colic. Research shows also when people just inject LPS on the horses, they form, they start having gut pain as well. So this is something to think about. The other thing too is that laminitis can lead to colic, and colic can lead to laminitis, and they both can lead to endotoxemia. Okay, so these are all important things for us to remember. When we have this huge dysregulated inflammatory response all over the body, we are going to have mediators that are pro-inflammatory and mediators that are anti-inflammatory, and there's going to be a problem because blood is going to be clotting in places, blood is going to be bleeding in other places. So these are things that we have to totally understand. I'm gonna probably write this on the board here. Hold on just a second. Okay, so let me share the screen. How do we do this again? Back. There. I put this more up. Yes, I can. Okay. So, endotoxemia, okay? So things that we are going to see, like I said, dysregulated inflammatory response, massive inflammatory response. In this inflammatory response, we are going to have multiple mediators, okay? Some of the mediators are going to be prostaglandins, okay? We are going to have thromboxanes. The most important of them is thromboxane A2. Prostaglandins, there's going to be multiple of them. Thromboxane A2, we're going to have nitric oxide. So thromboxane A2 impedes platelet aggregation. Platelet aggregation. Nitric oxide causes vasodilation, impede, okay? Platelet vasodilation. Prostaglandins, we're going to have prostaglandins causing vasodilation, dilation, or constriction. So that becomes, so how it's dysregulated. So depending on the signs that these horses are going to have, we are going to have different problems, okay? So, hold on, let me take a look at this here. No, thromboxane A2, so nitric oxide causes vasodilation. Thromboxane A2 promotes eraser. Promotes platelet aggregation. I said right the first time and then I said it wrong. Promotes platelet aggregation, so we're gonna have clots forming all over the body. So it's something that we have to cut off, okay? Prostaglandins, we're going to have some that promote vasodilation, some that promote vasoconstriction. Nitric oxide, we're going to have vasodilation. There are other mediators that cause platelet aggregation as well, okay? So here's the thing. So if you just imagine that this is what's happening all over the body, okay? We're going to start with, just so you guys can see. So vasodilation that we're going to have is going to lead this horse to have what we call shock. Okay, remember I talked about shock before. It can be massive loss of blood, so there is no circulating blood in places. In the case of endotoxic shock, is what we call distributive shock. Okay, so the blood is there. It's not like the blood has been lost, such as in an accident. The blood is there, but the blood is not, because there is hypotension. Vasodilation leads to hypotension. Because there's hypotension, we are going to have this blood, instead of circulating normally all over the body, is going to be trapped in the place that we call splanchnic region. The splanchnic region is the place of abdomen, okay? So it's a distributive shock. So the blood is still there, but because there is no tension, there's hypotension, the vessels are flabby, we are going to have this distributive shock, okay? The blood will be trapped there, so we need something for the horse. So the extremities of the horse is going to be cool to the touch because the blood is not there, okay? Shock is going to lead to what, guys? Shock is going to lead to a deficit in what? This is important. Perfusion. So these organs now, because there is no blood, there is blood, minimum amount. So the horse is still alive, but there is no perfusion in these organs. The horse is now, the organs will start to do what if there is no perfusion? They're going to start to shut down. So, and that's when I said, depending on what organ is compromised, is the clinical sign that we're going to have. So if we have renal failure, if we have cardiac failure, if we have other, like failure in the lungs, if we have brain, etc. So because there is, renal failure is the first one. The kidneys is the first one to go because the kidneys depend on the high level of blood at all times, okay? So the disease is going to be, the cardiac function is going to be compromised. There's going to be decreased coronary blood flow to the heart itself. So the heart can also fail. There's going to be increase in vascular permeability. So now the legs of the horse may be swollen because all this, remember we talked about inflammation. So the whole body is inflamed. So now the vascular permeability is higher. So we're going to have swelling in places. The disease is going to progress to systemic hypotension. And like I said, deficit in the perfusion of organs. And we're going to have endothelial dysfunction. So remember, the endothelial cells of the vascular places, they are going to be the ones that will recruit the inflammation, if you guys remember that, starting, as a matter of fact, with arachidonic acid, and then it forms into thromboxane A2, if you guys remember that. So there's going to be multiple organ failure. There's going to be, remember, inflammation, one of the first inflammatory mediators to be recruited is going to be neutrophils. So the neutrophils will be recruited first here too. So we're going to have, because all these neutrophils are recruited and they're being used, we're going to see signs of what we call neutropenia. So when we draw blood, there is zero neutrophils, not zero, but very little neutrophils in the circulating blood. So that can happen also. When we have a horse recuperating from endotoxemia, we may have what we call rebound neutrophilia. So now more neutrophils than necessary because the body is just trying to recuperate. One of the things that we have to clear all drawings is the problem that we're going to have with coagulopathies. Coagulopathies everywhere in the body. So we're going to have blood clots everywhere because now we have platelets clotting everything. We also have other coagulation factors that are built up from the liver. Okay, so we're going to have coagulation everywhere, but all these coagulation factors and these platelets are going to be busy coagulating things. And now it's the case of the horse that now you do venopuncture. So like to give Benamine, for example, and this horse starts to bleed nonstop, or a horse that needs colic surgery. But if you open up the horse, he's going to bleed to death because I know there's coagulopathies. There is coagulation happening everywhere. It's called DIC, disseminated intravascular coagulopathy. So there's going to be coagulation happening everywhere, but now areas that you would hope coagulation would happen, such as in surgery, such as venopuncture, you are going to have a horse that will bleed. So before, if the horse gets to the point of coagulopathies, you have to do blood transfusion on this horse before you can actually perform the surgery. And the surgery may be what's going to save the life of the horse. So you guys can see how problematic this can actually be when these horses get to this point. Sometimes you put a tube on the horse to try to remove all this liquid from the stomach of the horse, and the horse just starts to bleed more than normal. Okay, so this is something that can happen as well. So like I said, depending on what's happening to the horse is what the clinical signs we're going to see. So you guys need to understand, it's massive inflammation. We're going to have coagulopathies. We are going to have shock. So distributive shock. So we're going to have multiple organ failures, okay? So, and that's why the clinical sign can be actually, you know, depending if the horse is in shock, it can have white mucous membranes, but there is other types too that the horse is toxic and it has brick red mucous membranes as well, okay, from the inflammation. So if it's the shock, white. If it's just inflammation, brick red, because inflammation brings redness. There is, on top of the gum of the horse, you have what we call shock line, which there is a purple line on top of the teeth of the horse, and when the horse gets that, he is not doing really well, okay? The horse is not doing well. He's going to have cold. There's low circulation in the feet. This is a horse that's going to founder, so you have to start doing something to prevent the horse from developing laminitis. He's going to have low pulse. When you try to do pulse in areas, you're not going to be able to, because again, there's shock. The blood will be trapped, and you are going to have problems with, so sometimes because of the coagulopathies, you can see the membranes are going to have petechiation, so little blood clots everywhere in the membranes. Depending on if the kidneys start to fail, the horse is not going to be able to concentrate urine. If he's starting to have laminitis, he's going to have lameness, and then at that point he's going to have can have a rebound digital pulse, and the hoof becomes hot because of the inflammation in that area. And it's just like, so the diagnosis is just going to be, you know, based on what is happening to the horse. If the lungs start to fail, now he's going to have dyspnea, so difficulty in breathing, etc. So I hope you guys understand that depending on the organ that is being more affected, it is the clinical sign that we are going to see. Hold on, because my dog started to get upset here. Hold on just a second. Okay, so how do we treat these horses? So depending on what we have is how we are going to treat, right? So remember, we have massive amount of inflammation going on. So because we have massive amounts of inflammation, we have to treat. So let's see here, treatment. Let me just see here if I can do this and show to you all. Let's try to do this. So we have here the pathogenesis or the pathology, and we're going to have here treatment. Let me see, I've never done it this way, but this can be something that we'll have. So we're going to have what? Number one, inflammation, okay? See, my dog, hold on just a second. Okay, let me share the screen again. Okay, so inflammation. So we have massive amount of inflammation. What are we going to treat? Anti-inflammatory drugs. So non-steroidal anti-inflammatory drugs, of which well, first of all, obviously, we need to see what's going on with the horse and see if the horse has pyometra. We have to address that, remove all that pus from the horse. If the horse has pneumonia, we have to figure that out. If the horse has colic, those treatments aside from the endotoxemia, okay? We also have to remove, so inflammation we're going to do with non-steroidal anti-inflammatory drugs. If you guys remember, steroids can actually lead to, say, laminitis, so we're not going to be using those. The best drug, the drug of choice for this is Benamine. Benamine is going to take care of the inflammation. That is the problem, but also it is a scavenger. It has anti-endotoxin properties, okay? So this is another thing that we need to do, because there's going to be high levels of circulating toxins. We need to do what? Anti-endotoxin drugs. Benamine is one of them. Okay, so that's good, because it takes care of the inflammation, and also it is a endotoxin scavenger. So this is how we're going to do. So with what? It's hard to write with these things, guys. Don't judge me. Endotoxin not that my handwriting is beautiful in any way, shape, or form, but this is hard. Endotoxin scavengers. Benamine is one of them. And another one that's good is called polymyxin B. Okay? If you guys remember, for polymyxin B, I hope that at this point you do. It is part of neomycin, neomycin, bacitracin, polymyxin B. It is an antibiotic, okay? That is the reason why it's not used, because it's toxic to the kidneys, okay? So if you guys remember, that's why it's in the triple antibiotic ointment, but it has anti-endotoxin properties. So polymyxin B is wonderful. It's very expensive, okay? And you should not, if this horse is having signs of renal failure, this is probably not the drug to go to, okay? Because it causes problems, can cause problems. Another one that has endotoxins, or it has, how can I say? Well, Benamine is one of them. Let's go to another one. So the other problem that we have is, if you guys remember, we have vasodilation everywhere. Vasodilation, so hypotension. Let me call hypotension. Eraser. Let me call hypotension, okay? Hypotension. Remember, the blood is trapped. There's hypotension everywhere. So we're going to try to increase the volemia. So for hypotension, we are going to use fluids. So IV fluids will help with hypotension, plus lidocaine. Okay, lidocaine is, as we all know, lidocaine is a local anesthetic, but it also helps increasing the tension in blood vessels. So we can give lidocaine to hopefully increase the blood vessel tension in these horses. So fluids, lidocaine. For coagulopathies, we are going to try to do something to start to dissolve all these blood clots. So for that, we are going to use heparin. Heparin is the best, or aspirin, with heparin being the best, okay, for this. Now, remember, this is a horse. We're trying to dissolve all these blood clots, but heparin is an anticoagulant drug. And if this horse has a problem with bleeding, obviously heparin is not going to be the one that's going to be the best to use, because we need to figure that out first. So you may need to give blood transfusion or plasma to this horse, which also helps. So blood or plasma will also help with the coagulopathies, and then give heparin to try to dissolve this coagulopathies everywhere. There's going to be, if you guys remember, there's going to be nitric oxide all over, which helps with the hypotension. Hold on just a second. Something is happening here. Okay. So like I was saying, we have to figure out what's happening to the horse. After this horse is more stable, we will be able to, operate on him and be able to, and we can do, this is things that can be done semi quickly, okay? The other thing that we can also give to these horses, if you guys remember the nitric oxide, we're going to have free radicals, so reactive oxygen species being formed everywhere. So we're going to have free radicals. If you guys remember, those are the reactive species. And one of the things that we're going to have to give is how did you show up? I had put you outside. Antioxidants. And one of the antioxidants of choice in this case is going to be DMSO. DMSO. Now, DMSO has beautiful anti-inflammatory properties as well, and antioxidant properties. It helps with pain. So these horses that need colic surgery and everything, this will help start to restore. It has so it's a free radical scavenger, plus it has anti-inflammatory properties, plus it helps with pain. So that is going to be helpful as well. A lot of the times before you start giving polymyxin B, you give DMSO just because it's cheaper. It's very cheap, as a matter of fact, and it has properties that is hard to explain because DMSO is actually not even a medication, okay, anymore. What else? Depending on if this horse, how bad this horse is, if it's going to need resuscitation, the amount of fluid you're going to give. At this point, you have to, operate on the horse and see what is causing this problem. And at this point, you need to hopefully get rid of the insulting problem that we are going to have. And then if the horse is alive, now you're going to have to figure out what organs have failed to see how to treat for those. So if you're going to have laminitis, it's going to be with shoeing, and there's a whole protocol for that. If we're going to have, cardiac failure, you're going to see if the horse, is going to be able to survive with the new blood that he's receiving, etc. If we're going to have liver failure, we're going to start seeing yellow and, of the mucosal membranes, which is what we call icterus, or like jaundice. Okay. So different things, if the horse has lost, or if the horse was without oxygen because the blood trapped is causing neurologic problems, this is something that we have to think about too. He's going to start developing neurologic deficits, depression, seizures, etc. So having like a plasma bank is important for this horse because they may need to receive blood or plasma from other horses. So that's what I keep saying, that having a referral hospital nearby helps these horses because how do I do this? Because they're going to have a plasma bank, and they will have, more access to, say, polymyxin B, DMSO, everybody can have access to, but like, place for the horse to be, podiatrist, etc., to take care of laminitis in case this horse starts to develop that, which can develop rather quickly. So I just want to give you guys an overall idea of endotoxemia and how everything that can lead, and I've been saying, oh, it's controversial to treat salmonella with antibiotics because it leads to endotoxemia. So I've been wanting to just prepare you guys for this talk because it's a big topic. It's a syndrome. It happens everywhere in the body. There's going to be problems in multiple organs. And I just wanted to give you guys an overall, different organs, different clinical signs, and then different treatments depending on the organ that is actually failing. Okay, and how do we prevent? We need to prevent colic, so good management, low stress. We need to prevent no respiratory problems with horses. So if the horse is going to travel for hours, don't keep his head tied so high so it doesn't cause pleural pneumonia, which is shipping fever. Omega-3 fatty acids, which SmartPak sells them, or there's oils, flax oil, has them. They are anti-inflammatory in nature, so having a good amount of that in the horse diet may be protective. Probiotics may be protective, especially because you're trying to have more of the good bacteria and less of the pathogenic bacteria. And for the omega-3, you're trying to maintain inflammation low at all times. And and one of the most important things to prevent this from going bad is to intervene before it gets really bad. So when the horse starts to show sign, giving the Benamine right then, which scavenges the toxins and also stops the inflammation, is important. But just need to remember that you can't give that much, because so it's the correct dose, because Benamine in itself and other anti-inflammatory drugs will cause renal failure, and will cause colic, because they can cause like this GI tract horrible inflammation also. So just, to give you guys an idea on what to do. Now, this is a big topic, and that's why I put the PDF of the book. And I also put a summary, which is more or less of what I talked about right here, right now. If you guys have any questions, do not hesitate to contact me.